For comfort and luxury at its best, they do have a number of services like, of course, different dishes and continental dishes together with Ugandan food as well. They do have buffets from Monday to Sunday, and you can go out with your friends and family and enjoy that particular buffet. They also have a swimming pool, health club, and a spa where you can go and do some pampering of yourself and, of course, your friends and family. Do not forget to go along with them. They have a swimming pool where you can go and relax and, of course, stretch your muscles a bit, and also accommodation where you can sleep in with friends and family. You can book your reservations with that number that you are seeing on your screen. They are located in the heart of Entebbe, and that is Protea Hotel by Marriott. It is issues at hand, and as usual, we are going to look at the issues that affect us directly as Ugandans, but also Africans and the world at large. And of course, under these issues, we have educational, inspirational, social, political, and economic topics, but also health and lifestyle. Exactly how are we living to make sure that we are healthy, because a healthy mind is a healthy person, a healthy body is a healthy person. If you are not healthy, then of course there are a lot of things that could go wrong. So today we are here to talk about health, and particularly we are looking at the situation of the blood, the donated blood in Uganda, the situation, and of course where they stand as stakeholders who are responsible for collecting this particular blood. Remember, last month we had a shortage of blood in hospitals, and of course we decided that we need to address these particular issues. According to my guest, this situation has since improved, and we are going to see how. Her name is Sarah Mutegomba. She is the programs manager, blood donor recruitment at the Uganda Red Cross Society. You're most welcome today.
Thank you.
You can
Good morning, viewers. As been introduced, Sarah Mutegomba. I work as a programs manager at the Uganda Red Cross Society in charge of blood donor recruitment.
Okay.
And Uganda Red Cross Society is a humanitarian organization that works in partnership with the Ministry of Health, particularly the Uganda Blood Transfusion Services. And we have a mandate to ensure that we bring in donors that donate this blood. We create awareness to them, and they make an informed decision to donate blood. Yeah.
Thank you. Now let's start with the mandate of the Uganda Red Cross Society. You've mentioned something simple about it, but particularly the Department of Blood Donor Recruitment.
Yeah.
What is your mandate, and how do you execute it on ground?
Now, just to give it a background, blood is donated by volunteers. And Red Cross, as a humanitarian organization, we support through voluntarism.
Okay.
So that derives our mandate that we are tasked to recruit volunteers that can donate blood. And in Uganda, like in other countries, blood is donated by volunteers. Okay. And if these volunteers are non-remunerated, that means we don't pay them. We don't exchange blood with anything. So they are non-remunerated. So as Red Cross, we start with our volunteer base that is in the country, but also expand it beyond the membership of the Red Cross and look for other volunteers in the community.
Okay.
In Uganda, just a brief history, before 1989, blood was hospital-based and collected from family replacement. So if you had a patient, you would go to hospital and you are supposed to donate blood for your patient. Now Red Cross comes in to change that, and we go for these volunteers. And why we did that was to ensure that blood is collected and screened ahead of time and prepared for the recipient, because under the family replacement system, you would wait to have a patient, then you look at the time lag that you will lose time as you look for relatives to donate blood, which blood has to be screened. So we are losing a lot of lives. But our strategy now is to look for these volunteers ahead of time. We take their blood, screen it, and ensure that it is safe before the patient comes in to get this blood at the hospital facility.
Okay.
Now we are working in partnership with the Uganda Blood Transfusion Services, and when we sensitize and create awareness to these volunteers, then the blood bank is ready to collect blood from them. But in our package, we don't only create awareness, but we ensure that we give pre-donation counseling to those people. Of course, we tell them what they expect when they are going to donate blood. We address their myths and misconceptions about blood, and then we ensure that we motivate them, because so many people are scared of giving blood. Some of them fear the needle, others have a lot of, cultural beliefs that are negative to blood donation. So our role is to ensure that these people are sensitized well enough, and by the time they make a decision, it is based on the facts that we give.
Okay. Thank you. Now, you talked about awareness creation, and maybe just shed a light on how exactly you prepare to sensitize or bring awareness to our communities. Is there a way you do it? Do you plan a training? Are there particular people who are responsible for this kind of thing? How does awareness creation go? Because it's not easy to mobilize a community and make sure that they are listening to you. How do you go about it?
Yeah, we deploy several strategies. Of course, our biggest donor panel is in schools. Okay. So work with the school administration and speak to them about the importance of blood, and they organize these students for us to attend the awareness creation sessions. But also outside the schools, we go to places of work, like we are here at Family TV. We speak to the administration, and we ask them to allow us to talk to the staff. Now, that's what happens in organized places. We work with the administration of those particular places.
Okay.
Now, in the wider community, again, we go through the community structures of maybe LC1s, the local leaders, or opinion leaders, or if it's a religious institution, we go through the religious leaders, and we always seek for permission, and then we set a date and time when we can have these gatherings, and always the communities are supportive. They give us audience and they mobilize people for us. But also we use IES materials that we pin around. We share also social media information to wherever it applies, depending on our target audience. So we do it thoroughly by informing people that will be here and they would expect to see us. But before we even go to a particular community, we also do some assessment. Of course, something that we need to consider is that blood is potential of carrying infections. So we must also assess where are we going to, collect this blood. And we always emphasize in our awareness creation campaigns the safety issues about blood, because they are terrible diseases. If you pick them with the blood and take this blood to the patient, then they will be in danger.
Okay.
So also assess and make sure we speak to you about the facts. For example, HIV, we need to know your history, we need to know how you've been faring, if you have had test or any other ailments that you may have. So safety issues are critical, because the blood donor to us in this industry is the product that we bring in the processing in the processing of the blood. So if we bring in a safe donor, then we are sure that we'll get a safe product. And if by any chance the donor is not safe, then that means that we shall not get safe blood. So our awareness creation campaigns are structured in such a way that we get organized, come into a particular place, we give out the information, but we also look at our target audience. Can they listen to us? Can we do video? Can we use other means, alternatives that we can use to make sure that we address those that are literate and those that are illiterate? So our package is for everybody that can listen to us in that way.
Does that involve counseling and motivation as well?
Yeah, our initial awareness creation is general to everybody, just for information purposes. Okay. Then after that, people can volunteer and say, I am interested. Then we go counseling now to those individuals that are interested. And also by addressing their fears, then you're motivating them to be strong and really have the confidence that they can do this without any harm to them.
Okay.
Yeah.
Now, of course, we know that safety of this particular blood is important. So how do you and other stakeholders make sure that the blood that is donated is safe for use?
Now, usually, even before you go to a health facility, you have a clue of what is not going well in your life. So we start with what you know, and then we discover the unknown. For example, if somebody is to donate blood, they must be healthy and feeling well. We start with a simple question: how do you feel now? And that helps us to establish whether a person is feeling well or not feeling well. And then we probe further to understand if you have a headache, how long has this headache been? Do you have a history of a medical conditions that are chronic, or it is just circumstantial? So look at your health, but also your behavior that could lead to a certain condition. So we don't have like 100% guarantee that by speaking to you, of course, the blood is safe, but we give that allowance that at least if you have the basics, then we can take the blood and also again do the screening. So safety is ensured when we test this blood. Before that, we do the basics, give you information, you make an informed decision. But also there are other simple examinations that we do on site. For example, we need to know how much blood you have, and that test will be done on site. We need to know how old you are. Are you of age? We start collecting blood from those who are 17 years. So if you're below 17, then you don't qualify to donate blood. Then we check your weight. By the age of 17, you should be at least 50 kilograms. So if you're less than 50, then that's a pointer that maybe something is not right, you're not growing well, or you have an ailment that is chronic. So safety has a lot of other things that are entangled in there. But again, we go step by step to establish if this donor is really fit for donation. And our main principle is that we don't want to do any harm to a person who wants to donate blood. So safety to a donor is critical before we even look at the recipient of this blood. And it's a whole chain. We look at the vein of the donor until the vein of the recipient of this blood. So all those processes that we go through before the recipient of the blood, safety is ensured.
After the safety, of course, there is shelving, or what I would call storage of this blood, that should also be very, very safe, because blood is delicate. So can you take us through the process of storing the blood to make sure that it does not go bad?
Now, the storage starts immediately after the blood gets out of your vein. So it's stored in a blood bag, and the blood bag has nutrients that keep this blood the way it should be in your body. So those nutrients keep the blood, and that is the first storage. So we also have cool boxes that have temperature gadgets that make sure that blood is stored at a particular temperature. So throughout from the field where we collect the blood to the facility, that is the blood bank, we ensure that safety is also observed. The handling of the blood can be also dangerous, because there could be cross-infection if you don't handle this blood well. So our staff, the blood bank staff, are trained and qualified to ensure that safety is observed at each and every stage. Now, when we reach the blood facility, this blood is stored in a cold room, because temperature is critical in keeping this blood alive and safe. And blood can only be kept for 35 days, but it has to be kept in a cold chain. So when it enters the cold room, then the samples are taken off for testing, and then the storage again, it is the cold chain until it leaves the blood bank facility. That is only the safe blood that leaves the facility to go to the hospital. Now, within the hospital setting also, the cold chain must be maintained. These hospitals have what we call mini blood banks, and the cold chain in there is also observed to make sure that before the blood goes to the vein of the recipient, it is kept at certain temperatures that will keep it well. If it's not handled well, actually, the 35 days may not, be good enough. So it can even expire before 35 days.
So after 35 days, then it expires, whether it's in a cold room or what, after 35 days?
Yeah, it expires after 35 days. But usually, because the blood quantities that we collect are insufficient, so we rarely get a blood that expires, because what we bring in is what is taken out and used.
Okay, so let's now go to the donor. The donor must go through some procedures. Counseling and motivation and awareness we have already talked about. So now we get to the donating? What is the procedure for one to donate blood?
Yeah, the procedure again starts with one-on-one counseling with a nurse, and that is a Ministry of Health staff that is professional in doing counseling. We call it pre-donation counseling.
Okay.
And this, we go through your medical history. We have a questionnaire that you helped to fill. If you can read and write, you fill it yourself. But if you need help of the nurse, they will take you through by asking you questions related to your medical history. And then if you fulfill all the requirements on the medical form, then we'll do the HB screening, and that's an estimation of how much blood you have in your body.
Okay.
And we only take off blood when you have enough blood to donate. And donation should not cause you any harm. It should not make you feel dizzy. It should not be that we take off all the blood that you have in excess. So if you pass that blood estimation test, then you go to our donor coaches, and that's where the donation starts from.
Okay.
From your vein to the blood bag. And this blood bag, you can take between 3 to 5 minutes when you're donating blood.
Okay.
If your veins are good and the weather is good. Usually when it's a cold weather, the veins collapse a bit and you take a bit longer, but it doesn't go beyond 7 minutes,
Okay.
the actual donation. Now after that, we need to observe you like for 5 to 10 minutes to see if there is any adverse reactions, because like I said, people fear the needle. So there are those that have the phobia for the needle, and you know, sight of the needle can only scare you. So we want to observe you to see, are you getting adverse reactions? If they are there, then we give you first aid, because that's all you need. You don't need medication. But we look after you, and we also give you something to take as we observe you. We usually give a soda or water and a biscuit, but that is intended to talk to you as you're taking something, but also for that drink that we give you is to replace the volume of water that you lose as you're donating blood. And if within the 5 to 10 minutes you're okay, then you are free to go and do your other work.
Okay.
Yes.
And eligibility, who is eligible to give blood and who is not?
Now, it all rotates around safety. So if by any chance we establish that you're not safe or your blood is not safe, you don't qualify to donate blood.
Okay.
But like I mentioned, the basics that we take you through is the HB, that is the hemoglobin estimation. So we take a sample of blood to establish whether you have enough blood. Then your age, which is 17 to 60 if you are a male, and 17 to 55 if you are a female. So those who are outside that age bracket, they don't qualify to donate blood. The third thing we look at is your weight, at least to begin with 50 kilograms, because by the time you reach 17, you should be at least 50 kilograms. If you are 17 and 20 kilograms, obviously that's an indicator that you're not growing well, or you have a medical condition that is retarding your growth. So investigate and advise if we found you are 17 and below age. Again, if we found you with little blood, again, that is an issue of concern that we discuss with you and help you to understand. And usually this condition of not having adequate blood is, if you're not sick, it is usually feeding. If you're not eating well, then you will not have enough blood. So I would advise you on what to eat and improve your diet so that you can have enough blood. Because that condition of not having blood is dangerous to your health. If you fall sick when you don't have enough blood, then that will be detrimental to your health.
Okay.
And then we'll look at other conditions. If you know, for example, if you have hypertension, if you have diabetes, if you have sickle cell, if you have any other medical condition, would disqualify you from donating blood.
Okay.
So the rest of the things we go into details depending on what you present. If there is none, then you qualify to donate blood.
Okay. Of course, like any other field, I believe that this particular field has its achievements but also the challenges. And I would like us to look at some of the challenging parts or bits about blood donation.
Well, the challenging bit is that people who donate blood are very few. The World Health Organization gives us an estimate of 1% of the country's population to be blood donors. Now, with an estimate of 45 million Ugandans, we are supposed to have 450,000 units of blood we collect annually. Our statistics indicate that in the last financial year we collected 313,000 units of blood, which is far less than the WHO recommendation. So our struggle and challenge is to motivate people to donate blood. There are people who actually don't know that this blood is donated, and they only hear about blood when they get a patient in hospital. And that comes back to the awareness creation bit. People are not aware that they can donate blood. Most of the people donate blood when they are students. Out of school, they stop donating blood. But like I said, we are now marching up to the 1% requirement. But this is not a static figure. So when you look at population increase, that means the 1% applies to the population increase.
Okay.
So the biggest challenge is that we don't get enough donors. If you look at the figures, we only have 0.5% of Ugandans that are donating blood.
Okay.
And all these other challenges now come in because there is no adequacy of the blood that is being collected or the blood that is being donated.
Okay, now do you pay anything to access this particular blood? If I'm a patient and I'm in hospital, or if I have a patient in hospital, do I buy the blood for them if they are in need?
Now, that's an interesting question. Blood is actually free in all health facilities. That doesn't mean that there's no cost attached to it, but the government of Uganda pays the blood, pays for all the costs that are charged on the blood. Collecting 1 unit of blood costs us up to $85, and that is a bill that is paid by the government of Uganda. Okay. So the policy is if you are to access this blood, then you shouldn't pay for it because the government has already paid for all these costs that are involved in collection, in screening, in storage, and distribution in the health facilities.
Okay.
But of course, the challenges that we face also under that alleged sale of blood, where people are charged, and we hear that it's a varying charge. And sometimes it's not actually charged for blood, but what is used. For example, if you're to do a cross-match in hospital, then we need some reagents, and some of these facilities, especially the private facilities, do use their money to buy these reagents. There's what we call a giving set. From the blood bag to the vein of the patient, you use a giving set. So people charge that giving set to give your patient blood.
Okay.
And again, the bottom line is that selling of blood is illegal for the one who buys and sells. So it's not a recommended practice, much as we hear that it happens. And we usually give advice to our patients or the caretakers that if you go to any health facility and they ask you for money, please notify us. If it's really critical that you can't reach out to let us know, please take note of the following. The blood bag that we issue has a unit number. Take down that unit number, record it for us, and also get to know the staff that was working on your patient. In the blood bank system, we usually track our units of blood, so we know which unit went to which facility, and we ask these facilities to give us accountability of this blood. So when we get this information, which is also similar to what we issue out, then we shall hold somebody accountable. But usually, most times, people are ignorant. They actually don't know. First of all, they have never donated blood, so they don't have this simple information. The first time they hear about blood is when they have a patient and they tell you your patient needs blood, and you can imagine that fuss and also fear, you're about to lose a life, so people fidget.
Yeah.
But usually those who call us, we come to their rescue and make sure that we give a service free of charge.
Okay.
And we encourage them and we empower them to report these cases of malpractices that usually happen in the health facilities.
Okay, there is word that there's shortage of blood around health facilities, but also the blood banks. And this word, of course, came out last month, and there was worry and tension among citizens. What is the current situation of the amounts of blood available?
Yeah, we had a bit of crisis last month.
Okay.
because it builds up again through the festive season. Like I said, blood expires after 35 days. So for us, our role is to make sure that we bring in a unit of blood every day.
Okay.
Now, when you look at the festive season, you realize that almost 2 weeks people are in festivities and they don't pay attention to giving blood. So the numbers reduce. And once those numbers start reducing, then we can't catch up until we have a big, drive that we do that will bring in the numbers. So in the last month, we had shortages here and there, but it also starts with how much do we collect? Are we able to satisfy the demand? So the quantities are still low, and if we break and we don't get, inflows that are consistent, then that culminates into the crisis. But as we talk now, the situation has improved. We are getting more donors, especially our student donors that have resumed school. But also what concerns us is that people always make it an issue when there is no blood, but I've not had people raising their voices to say that we want to donate blood. And that's something that we should take as a personal responsibility. If you know that blood is donated, please endeavor to donate blood. And make sure once in your lifetime you donate at least a unit of blood so that we keep the circulation and also have the sufficiency of this blood in supply.
Okay. There are different blood groups as the medics or the health practitioners have put it. And these blood groups, of course, have particular people that they can help in case the blood is donated of those blood groups. Are there any challenges with some blood groups not, matching the patient's the patient ratio? So the blood patient ratio, is it different? Or then also, if some people of a certain blood group are not giving blood, then what happens? Some particular people.
Yeah, obviously, I mentioned about the cross matching, and this helps us to know if you're to receive blood, what type are you eligible to receive? And there are particularly 4 main blood groups, that is the A, the B, the AB, and O. Now, for you to receive blood, you must be compatible with the type you're going to receive. Now, challenges come in when we get what we usually term as rare blood types. For example, the minus types. I said there are 4, but they can be categorized into 8, 16, and so on, depending on what factors you're looking at. So in the major categories of the A's, the B's, the A, B's, and the O's, we have what we call a rhesus positive and a rhesus negative. Now, most of our people in the population are rhesus positives, and few are rhesus negatives. So you realize that if we get a patient who is rhesus negative, that is a crisis. We need to look for that blood. Probably if you went to the city square and collected 200 units, you may rarely get a negative blood type. So if a patient is in hospital and is a negative blood type, that becomes a crisis, and we need to look for a donor that is compatible with this donor. But in our system, again, we've documented the donors that we find they have the rare blood types, and we reserve them for that time when they have when there is a patient they can serve. So we have our e-office system that is used in the blood bank, but we also have Blood for Uganda application where we register these donors, and we activate an alert on the app. It is both on Google and Android, and Apple Store. So the system there captures whoever donates his blood group, but we pay special attention to the negative blood types. So if we get you are a negative blood type, we reserve you for that time, and we usually make phone calls, pick these donors, take them to the facility they donate, and we make sure we avail blood. But between the needs and how to find this donor, again, it takes time. So it could be an emergency, like a mother is in labor and this patient needs blood within 30 minutes. And by the time you look for this donor, screen the blood, take it to the facility, that's a long story that can lead to a loss of life. But the biggest challenge there is that within the population that donates blood, certain blood types are rare. And you can't find them. So it's a challenge that we usually face when we get those rare blood types.
Okay, now moving on to the achievements after we've looked at the downside or the challenges. Now we get to the achievements of this particular role of donating blood. Are there any achievements you have, acquired as stakeholders in the blood donation entity?
Yeah, several achievements have been made. Of course, I hinted on the fact that this campaign started in 1989, and we are transforming from a hospital-based blood bank to a centrally managed blood bank, which is having its headquarters at Nakasero Blood Bank, and also regional blood banks that are based in Arua, Gulu, Mbale, Mbarara, Fort Poto, and we have sub-regions in Masaka, Chitovu, Lira, Soroti, Kabale, Rukunjiri, and so many others. And we are having other 3 that are coming on board. In Soroti, it's becoming a regional blood bank, but also in Hoima and Arua. So since that time, of course, the achievements are that we've been able to expand from a facility in Nakasero to have these regional blood banks. And that helps us to collect blood from within the region. And that also addresses the issue of within the region, you have the same blood types, and when we collect again, we shall be able to satisfy the demands of that region. But also it reduces on the time. If we are to get blood from Kampala to take it to Gulu, we all know how long it takes you to reach Gulu. You can only possibly fly, but how often will you fly and the costs that are involved? So when we have these regional centers established within our region, then that reduces on the time lost if we are to save a life. But also over time, we've made progressive improvement in the units of blood that we collect. We started with very few donors. Now we are celebrating donors that have donated over 100 times, 120, 200 units of blood. That has also increased on the donor base, where we have now currently 90,000 donors who regularly donate blood, and the numbers have increased. But we've also worked with religious institutions and cultural institutions to really mention the issue of the importance of blood, and we would like to thank the Church of Uganda that have really been supportive in these campaigns. We go to the churches, they preach, talk about the verses in the Bible that teach about blood, and people understand better than we would call them for a gathering in town and we tell them about blood. So the service has expanded from the small facility in Nakasero to the regions, but also the numbers of the blood donors have increased, and that also has obviously annually we increase our targets to make sure that we serve and give adequate supplies of blood. So last financial year we had a target of collecting 300 units of blood, and we are able to collect 313,000 units of blood, which is a big achievement. Yeah.
Thank you. Those are some of the challenges, but also achievements of donating blood or of the blood donation in Uganda. Now we have learned a thing or two about that, especially that paying or asking you for money when you're going to donate blood is very, very illegal, and that blood is always free. Now I am with my guest, Miss Mutegomba Sarah, and she is taking us through this discussion. But let's go for a very short break and return with more stories. Issues at Hand will return, and we are powered by Protea Hotel by Marriott Entebbe.
Issues at Hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.
This is Church of Uganda Family TV, enriching lives. Issues at hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.
Protea Hotel by Marriott Entebbe is our sponsor, and you're welcome back to Issues at Hand. Remember to follow the conversation on our social media platforms, different social media platforms, at X, at Facebook, and at Instagram at Church of Uganda Family TV, and then of course YouTube at Church of Uganda Family TV, where we are live currently. You can like, comment, and share with a friend about this content, and also leave us a comment, a message of what you think about the topic, and we will be getting right back to you. In studio with me is Miss Mutegomba Sarah, Program Manager, Blood Donor Recruitment, Uganda Red Cross Society, and we are discussing blood donation in general. Let's start with how long someone has to wait to donate another time in case they've donated. How long do they have to wait to donate again?
Donation is given a space of 120 days, okay. But we give a special treatment to the females because they undergo menstruation every month. Yeah. So for a man to donate, you donate after every 3 months, and for a female to donate, you donate after every 4 months. But again, we do screening again, and also give you counseling. If there's any other issue that would stop you from donating blood, again, we can stop you even when you are due for donation. But usually, the blood that you donate has a component that is a solid and a liquid. Now, the liquid part of blood, which is plasma, can be replaced within a fortnight. Okay. And the cells as well. So within 14 days, you can replace the cells that you donate the blood with. But for the fluids, you take water. Within just 24 hours, you've replaced the amount of fluid that you lost when you're donating this blood. So our regular interval is 3 to 4 months, males and females, respectively. Okay.
And let's take a look at what the government has contributed to the blood donation. Do you think the government has been supportive in this particular area?
Yeah, this entire blood safety program is actually managed by the government of Uganda. Okay. The external support that comes from humanitarian organizations like the Uganda Red Cross and other parastatals give a supplementation to what the government does, but it is a fully funded program of the government of Uganda under the Ministry of Health. So the government makes sure that whatever we need to collect this blood is available. But where we have a gap is that we are not bringing in enough donors. So my call to the population is that we have the facilities, state-of-the-art facilities, to ensure that this blood is collected, screened, and distributed. But we are short of the numbers, the donors themselves. Okay. And that's an appeal that please donate blood. Take it as a personal responsibility to think of donating blood at least twice a year. Give this blood, because you'll never know when you need the blood. When you're about to get an accident, an alert does not come. And when you look at the populations that receive this blood, they are so vulnerable. 60% of the blood that we collect goes to children who are under 5 that are affected by anemia due to malaria. So they are that vulnerable. They are below 17. They cannot give blood for themselves. And then the other condition is malnutrition among these children, with the current trends of mothers not interested in feeding their children. So they feed on food supplements, those that can get it, but also they don't get them in adequate quantities, timely. So you'll find that these children are malnourished. Now, the problem with malaria is that it attacks the cells, the white blood cells and the red blood cells at one go. So it destroys those cells very fast, and that means the body cannot manufacture enough cells to have this blood. And that's why you see anemia conditions usually lead into blood transfusions. So 60% of the blood we collect goes to these anemic children. Okay. Now 25% of the blood that we collect goes to the mothers who are getting pregnancy-related complications. Again, when you look at the feeding styles of the pregnant women, sometimes they don't want to eat. But most problematic is that women don't go for antenatal. They go for one visit, especially the first visit, but the subsequent visits, they don't go. And this brings a challenge, because when you go for this antenatal care, then they check you and see, and give you also iron supplements, so that as you progress through the pregnancy, you are taken care of as you do the antenatal visits. Now, when they do the first visit and they don't go back, again, the other worst case scenario is that they don't go to health facilities to deliver. They only bring them when they have got complications, they have got ruptured uterus, they are bleeding. That postpartum hemorrhage is a serious condition that can make us lose a mother within a very short time. Now, we encourage the mothers to go for antenatal care, but also deliver in health facilities where they can be taken care of. When it is a complication that requires a cesarean section, you must be in a facility where there is blood. Okay. Now, if you're transferred from a facility where there is no blood, you're bleeding, it takes less than 30 minutes to lose this life. So, again, the health-seeking behaviors need to be improved, because in the developed world, blood is not used for these cases. You can imagine 85% of cases that are preventable is what consumes a lot of our blood. So we'd want to sensitize more people to learn how to take care of themselves, so that we reduce on those numbers that take the blood. We want to go in advancement in treatment, where blood is only used for heart surgeries, for transplants, and those complicated, medical conditions. So we are still struggling with malaria. The government has been distributing mosquito nets. Please sleep in those mosquito nets to avoid malaria. And also take care of our children. Feed them well. Breastfeed them, so that they grow and become strong, and they are not affected with malaria. Yeah.
All right. Now, where would someone go, or where should someone go in case they have woken up and they are feeling the urge to donate? Where should they go?
Now, we have blood banks that I mentioned.
Yeah.
We have in Kampala, we have Nakasero Blood Bank, which is found on Nakasero Hill. But we also have a Rotary Blood Bank in Mengo Hospital. But we have 25 mobile blood collection teams that move out every day to go to the community. So if by any chance you see our blood collection team, please stop by and make sure you give this unit of blood. So we'll look for you. But also on the Our Blood for Uganda app, we publicize the venues where we are going to collect blood from. But you can also send us a request asking us to come where you are, where you have an organized group of people, and we can collect blood from you. So make good use of the Blood for Uganda application to know where we will be, but also you can request. The beauty about this app also, if you have challenges in the facility and they're asking for money, or actually there's no blood and you need some help, just send alert through that app and we'll be able to respond immediately.
Okay.
Yeah.
If somebody is found with an issue, say they've taken blood samples from them and an issue is found, maybe the person is sick, how do you handle that person? Do you just tell them to go, or do you first talk to them about it?
Now we have in our donor retention strategy, we take care of a person. People come to donate blood when they are not aware of their health. Now, for whatever condition that we discover in your blood, we provide counseling to you, and we do a one-on-one. We invite you to the facility, or we invite you to the venue where you donated blood from, and we take you through, counsel you, and help you to understand what the condition you have is. For example, we do screen for HIV, which is common and routinely tested by other facilities. But there are other chronic diseases like hepatitis B and hepatitis C, which are not so common in our population, but the information about the hepatitis is scanty. People are not aware. So you really need a formal counseling session for you to appreciate that you have this condition. And we also encourage people to go and take the vaccine for hepatitis B, because this disease is not treatable, but it can be vaccinated against. So we encourage the population to do a vaccine while they also change their health behaviors. Now, for any condition that we find, if you have HIV, if you have hepatitis B, or if you have hepatitis C, or if you have syphilis, you are supposed to be attended to by a nurse who is a counselor, and will also refer you to get additional medication or support if there is need to do so.
Okay.
Yeah.
Predict the future. We had an issue, a situation last month. Do you think that in the coming months we shall not see that problem anymore? Now,
the challenges of blood are usually seasonal. And we relate them to school holidays, because 60% of our blood donors are in schools. So we anticipate a crisis if there's a school holiday. Okay. But for the last 3 years, we've embarked on a strategy as Uganda Red Cross to take blood donation to the community, and we've partnered with cultural institutions like the Buganda Kingdom, where we now, during that time, we go to the counties of the Buganda Kingdom and make sure that we fill in that gap. And where we've usually done it, it has been successful and you've not had a crisis. Only that the last 1 month we didn't have these drives because of challenges that were faced by the organizers in terms of finances. But moving forward, again, we still see ourselves going back to that strategy to ensure that whenever there is a school holiday, we conduct a blood drive. Okay. And we are expanding beyond the Buganda Kingdom. We've been in touch with the Bunyoro Kitara Kingdom. We are working with the Omogo Development Foundation to ensure that within that region also we are able to collect blood. We've worked with the Bugwere Chiefdom. His Royal Highness Ikombania of Bugwere has also supported these drives in December. And we are taking it further to the Toro Kingdom, but also the Bukonzo Kingdom and any other cultural institution that will welcome us. And we want to regionalize it so that the burden is shared across board, because in our previous drive that we did with Buganda, we were able to collect sufficient supplies of blood that we shared with the whole country. So it is really practical and it's possible. So the seasonal blood shortages, the solution to it is taking these drives to the regions, and the cultural institutions are spearheading these campaigns to ensure that we have blood supplies that are adequate during the school holidays.
Okay, as we wrap up, you talked about creating awareness, and these are some of the platforms that you must use. So as you wrap up, as you give us your last words, you can do that for the viewers.
Yeah, at this point in time, I would like to thank Family TV for giving us this platform. We really need this publicity, and it is expensive for us, so we don't usually come to TV. So when you host us, we're really grateful for this time that you've given us. Okay. But also, again, Church of Uganda has really been instrumental in the blood drives that we conduct, especially the Masaza blood donation drive. We've had bishops, like the Bishop of Moko, the former Bishop of Mokono, Bishop Sebagala, was supporting us in these drives. We've had the former Bishop of Namirembe, Bishop Luwarira was our ambassador. Okay. And even the regions, wherever we go, we have a day for the church leaders to spearhead this cause, and they invite in the believers to come and be part of the drives, and we really appreciate. But also, as part of the achievements, Uganda is going to host a congress, an international congress here in Uganda, which will happen on the March 4th to 7th at Speak Resort, Munyonyo. And this is an African Societal Blood Transfusion Congress that is being hosted by Uganda, and it is bringing in people from all the blood banks in Africa, but also at the international scene. And here we are trying to see how do we adopt the innovations, because I can tell you the world over, blood is a challenge. No country has adequate supplies of blood. But through these innovations and adopting technologies is where we've been able to see how to improve. So during this Congress, we are privileged to host it, and we are going to benefit from the discussions that we shall share across board together with other stakeholders. So we invite everybody to come and join us in this Congress. We invite the media. You've already given us a platform, and we thank you so much for that. And we would encourage you to continue sharing these messages for people to know that blood is actually donated, not manufactured. There is no machine that manufactures blood. It expires after 35 days. So if you give me your unit today, come back after 6 months, I will not have that unit of blood. So speak to a friend and encourage them to be blood donors so that we keep the consistency of this blood supply throughout the year. And we lessen the burden from the students whom we think will always donate blood when the adults who are the biggest consumers of this blood are not contributing anything. So we encourage everybody that has 17 years, weighs 50 kilograms, having enough blood, but also living a healthy lifestyle, to pass by our drives and make sure you donate a unit of blood. We call it a blood bank because it banks blood anyway. So if there is no blood, then we have nothing to bank. But also at a critical moment when you reach hospital and there is no blood, that is the worst you can face in your life, because the doctors can do whatever it takes and then they will tell you, we've done our bit, but your patient needs blood and you can only get this blood if it has been donated. If it's not there, that makes the end of the story. And we don't want to lose lives on something that we can really, and we are having the potential to solve. We all have blood. It is a blessing from God, so let's donate it to save life.
Okay. Thank you so much, Sarah Mutegomba, for that beautiful discussion. We hope that you convey our regards to the entire Red Cross Society.
Thank you.
And we shall have you back again, I'm sure about that. Okay, thank you so much for watching Issues at Hand this morning. In case you have been on social media, thank you so much for being a part of this show. And of course, it runs from Monday to Friday. And until tomorrow, it is a good morning from me and the production crew.
Issues at Hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.